Due to the number of COVID-19 cases continuing to rise, several U.S. states, including Texas and Florida, have slowed down efforts to reopen their economy.
And while the death rate is at its lowest since March, the number of total cases does continue to rise in Georgia. Archith Seshadri reports from our Atlanta bureau on what health experts think may be the reason.
A new study shows the number of coronavirus cases in Georgia doubles every 4 weeks.
I'm sick and tired of this and I need to get back to normal. I think we need to adapt to a new normal.
Georgia can count a new record of COVID-19 infections. More than 4,000 people contracted the coronavirus this weekend, and more than 13,000 people tested positive in just the last week.
If I was in a very crowded environment, I would probably also would wear a face shield. I think we have learned a lot of the infections can come in through your eyes.
As the July 4th holiday approaches, health experts are concerned about a repeat of Memorial Day scenes with crowded beaches and bars.
I'm planning to go to the beach at some point this summer. I think we all need a break, and I think we just need to find a way to do it in such a way that we can practice some social distancing. I think this requires that we use common sense. Yes, go to the beach, find a place where you can sit, put your umbrella, sit, be far from people, go to the ocean, go to the swimming pool. But yes, don't go in the evening to a bar and hang out with a bunch of people, because that's where the risk is going to be. That's where you're going to get infected. Or don't make a party at your house.
Doctors say proximity and time play a key role in getting infected.
If I'm walking, around my block, I don't wear my mask because, again, it's just me walking and it's unlikely that I'm going to transmit to somebody.
Doctors say new data shows that younger people are contracting COVID-19, those in their 20s and 30s. But even though they're not showing symptoms, they're likely spreading it to the at-risk population simply because they're not wearing masks.
The elevator is probably not a problem. You wear a mask in the elevator, you're not in the elevator long enough to transmit. But it's very different than if you're in a small room working with somebody. So working with somebody in a small room has a much higher risk of transmission.
Reporting in Atlanta, Archith Seshadri, WJBF News Channel 6.